You know, we hear on the news a lot of times, especially in plastics, that they cause certain diseases. And it seems like there's always new plastics that are coming out in the marketplace.
Yeah.
But we really don't find out about it until we do the research after the fact.
Yeah.
Because I don't know if there's any tests that we can do before something gets approved to be used. You know, so what have you discovered in that result?
So what I'd like to see happen, I think that the food industry and the packaging industries are doing things for the good. That's their goal. And if something that they're doing is less than optimal, they don't realize it, and it takes us a long time because of the way we do things. So I'd like to see much stronger relationships between industry and academia in order to test these things, not necessarily prospectively, but certainly at the point in time when they come onto the market, to find out whether or not there are problems. If you look at the amount of research that's supported, for example, by the pharma industry and device industry, it's more than half of biomedical research. It's a wonderful contribution. It's led to lots of new drugs, and it tends to be a very good collaboration, and one that we couldn't do without. But if you look at what goes on with for example, the food industry or the packaging industry, they support very little research and very little nutrition research. So I think we need to form better collaborations where each of these groups takes care of their interest. So a food company has to make money, that's for sure, and we support that. But a researcher has to learn things and understand disease and help to cure it. And I think we each have to respect the other for what their real goals are, and work so that the products that come into the market are carefully looked at least very early in their arrival, so that we don't, as we do now, have some 5,000 compounds that have not really been tested.
So you said in order to find out if certain environmental factors are affecting people's health, you have to be able to measure something.
Yes.
And you had mentioned beta cells. You know.
That's because that's what I've also measured in liver cells and fat cells.
Right. So you see these chemicals in our blood system, but you have to determine.
I don't see that. That's not correct. I don't test them in our blood system. That needs to be done. And it's beginning to be done. For example, NHANES study has published results on the levels of BPA in the blood of people who are lean and obese, and there are differences.
So what do you measure in your research?
So what I do is look at the things that have come into our environment and ask, do they have the potential to alter our metabolic responses? So all I am doing really is looking at the potential. But if I see a good potential, then, and that's the first step, the next step would be to do further testing. So that's what I'm proposing and a proponent of. But I don't want, for example, we have nice data with saccharin showing it has this effect. Well, I don't mean to imply that saccharin is bad and is the cause of diabetes. I have no data that says that.